All right, today we're going to talk about something that's a huge risk for our pets, but it's one that you often can't even see until it's way too late. We're talking about heartworm disease. And look, this isn't just about some gross parasite, it's a silent threat that's actually getting smarter, and that should have every single pet owner paying attention. Okay, let's dive right into this. This quote, it's from a recent scientific journal, and it's not just some dry academic warning. No, this is the opening scene of a global detective story. A strain of heartworm that can resist our drugs has officially jumped the Atlantic. So, the big question is, how on earth did it get there? Well, meet the unwitting accomplice, a 2-year-old Australian shepherd. She was born in Louisiana, which is a known hotspot for heartworm, and was adopted by a loving new family in Italy. In June of 2023, after this whirlwind trip through Paris, Venice, and Padua, she finally landed in Rome, and it was there that vets made a shocking discovery. She was carrying this new, resistant form of the parasite. She had become an unknowing stowaway, carrying a new threat across continents. So, that one dog story, it really just pulls back the curtain on a much, much bigger problem. To really get why this is so serious, we've got to understand the culprit itself. So let's unpack how a single tiny mosquito bite can spiral into a life-threatening disaster. The fancy scientific name is Dirofilaria immitis, but you and I just call it heartworm. It's a roundworm that literally sets up shop in the most critical real estate in your pet's body: the heart, the lungs, and all those major blood vessels. It lives right in the engine room. And the only way in? A mosquito. And this is where it gets both brilliant and terrifying. So it starts when a mosquito bites an infected dog and sips up blood that's loaded with these microscopic baby worms. Inside that mosquito, those little larvae grow up for about 2 weeks. Then that same mosquito bites your dog and injects those now infective larvae under their skin. But here's the really insidious part. For the next 6 months, those larvae are on a silent journey through your dog's body. Your dog looks fine, acts fine, no symptoms at all. But all the while, these worms are migrating, growing, and heading for their final destination, the heart, where they mature into full-blown adults. And when we say adults, we aren't kidding. Just look at that number. A single heartworm can grow up to 35 centimeters long. That's over a foot. Now, just try to imagine not one, but dozens of these things, all tangled up like spaghetti, living and breeding inside your pet's heart and lungs. It's a truly horrifying thought. And the end result of a really bad, untreated infection is something called Cavol syndrome. This is the absolute end game. It's when the ball of worms gets so big that it literally creates a physical dam, blocking blood from getting back into the heart. It is a catastrophic emergency, and often the only hope is a super risky surgery to physically pull that massive worms out. Okay, so now that we understand just how grim this threat is, let's switch gears and talk about our defense plan. Because vets have really solid, well-established ways to both diagnose and treat this parasite. So the very first step is diagnosis, and getting your pet tested every single year is crucial. Vets usually use a 2-pronged attack. There's the antigen test, which looks for proteins that only adult female worms release. Then there's the microfilaria test, which looks for the baby worms swimming around in the blood. You really need both for a complete picture of what's going on. Now, if a dog does test positive, there are 2 very, very different roads you can go down for treatment. On one hand, you have the method recommended by the American Heartworm Society, the AHS. It's the gold standard. It kills 99% of the worms. It is intense, though, and requires a lot of rest for your dog. Then, there's the other option. It's often called the slow kill method, and as you can see, it can take over 2 years to clear the infection. And, here's the massive red flag, it carries a huge risk of creating those drug-resistant strains we've been talking about. And that right there brings us full circle. It takes us right back to that stowaway dog from the beginning of our story. Because the choice of treatment, it isn't just about what's best for one dog. It has consequences that can ripple across the entire globe. Let's be perfectly clear on this. The slow kill method is officially not recommended by the experts. Why? Because when you expose these worms to low doses of medicine over a really long time, you're essentially weeding out the weak ones. The toughest, most resistant parasites survive, and then they reproduce, passing on those super strong genes. It's literally survival of the fittest happening inside a dog's heart. And this danger is not just a theory. Not at all.
A study found that one-third, a full 33% of dogs that showed up at a cardiac specialty clinic with that life-or-death Cavill syndrome were currently on a slow kill protocol. The very treatment they were on allowed the disease to progress to its absolute deadliest stage.
Look, I know this all sounds incredibly grim, but the story does not end here. Because while this threat is getting smarter, our best defense is actually incredibly simple and almost foolproof. It all comes down to one word: prevention. So here it is. This is your 4-step playbook. It's that simple. First, always test a dog before you start them on a preventative. Second, use that preventative all year round. No skipping months. Consistency is everything. Third, keep up with those annual tests, even if they're on prevention, just to be 100% sure everything's working. And finally, just do the common sense stuff, like trying to reduce their exposure to mosquitoes when you can. And really, that entire plan just boils down to this one single crucial idea: the power of prevention. Because preventing this disease is always safer, cheaper, and so much kinder to your pet than having to treat an infection that's already taken hold. We started this with a scary story about a drug-resistant parasite traveling the world, a problem created by shortcuts in treatment and prevention. But we end with a simple, powerful truth. This is an almost entirely preventable disease. So the only question that's left is the one for you. Is your pet protected?